Hello, and thank you for joining us today for our microdermabrasion training. Today's webinar is really going to go over everything about the theory of microdermabrasion as well as how to conduct microdermabrasion with our NP1 microdermabrasion device. So why microdermabrasion? It's really one of the top requested services in the spas today. Why? It's really gained a mainstay as a lunchtime service or a quick no downtime service. We really need to be competitive, however, when we provide microdermabrasion. Most spas have some form of microdermabrasion for their clients. It's important to understand that the NP1 microdermabrasion device offers the most progressive type of microdermabrasion available, utilizing different grit tips, different vacuum settings, and one of the most powerful suction devices. It's a very results-driven service with well-documented evidence of its efficacy for certain unwanted conditions, such as rough texture, pigmentary damage, laxity in the skin, and more. It really provides the next level of treatment for those clients that need corrective work and when other services aren't quite enough. So what is microdermabrasion and how does it really work? It started in Europe almost 2 decades ago and really has been performed in the United States since 1993. Unlike a lot of trends in this industry, this one came and stayed. It's the most natural way to evenly and safely exfoliate the skin without chemicals or a laser at a spa. Microdermabrasion is known as a mechanical exfoliation technique that buffs and polishes the surface of the skin. It's the process of removing about 2 to 4 microns of dead skin cells and debris and improving the superficial texture of the skin. This is precisely why microdermabrasion is designed to do. By taking out these dead skin cells and exfoliated, it reveals a much smoother, healthier appearance. It can also stimulate collagen to create a toned, tightened effect to the skin through a vacuum massaging of the skin. Who can benefit from microdermabrasion? It really can be safely used on all skin color and skin types, with the exception of a very severe rosacea or other inflamed conditions such as pustular acne. The rule of thumb is this is a very stimulating mechanism to the skin, so you wouldn't want to use this on a very highly sensitive skin type or an irritated skin type. On the other hand, it's a vital service for a very sluggish, congested, mature skin type. Microdermabrasion is considered a very safe, common, non-surgical procedure. However, there are a few people who should not receive this service. We should be avoiding the following conditions, or these conditions are contraindicated to receiving microdermabrasion. If the clients have a current outbreak of herpes, it is considered to be contraindicated. If a client has tendencies for cold sore breakouts, it is recommended that they pre-treat and post-treat for 3 to 5 days before or 3 to 5 days following to make sure that we ensure that they don't have an outbreak. This can be done with any over-the-counter preparation or by prescription from their physician to ensure that we don't elicit any herpes outbreaks. Keep in mind, it's a very stimulating process, so the stimulation through the heat generated or the mini massage generated through the vacuum, it can actually increase activity of these dormant cells. It's not a wise choice over a very pustular acne because pustular acne can be associated with some pain and discomfort and also to prevent the spread of bacteria. It's always a wiser choice to make sure that we've gone through a couple good detoxifying, extracting facials prior to starting with microdermabrasion. On the other hand, it's a very successful treatment for a non-inflamed acne or a very comedone-prone skin type. Not a great idea on a more chronic rosacea, subtype 2 rosacea. These are those clients that are suffering from this chronic inflammation where the skin always appears to be sensitive or that there's heat generated in the tissue. I always say to make sure that we let the skin speak to us. If it's eliciting signs of redness and inflammation, then perhaps a stimulating treatment like microdermabrasion may not be a good choice. However, on a subtype 1 or a very mild or acute rosacea condition, it can be utilized in a very low vacuum with a very low grit and perhaps one pass to make it successful. At no time should we really over-aggravate this condition. It shouldn't be applied, again, over any open sores or unsuspected or undiagnosed lesions. or if the clients have any other known skin disorders like dermatitis or psoriasis and or eczema. It's always a good policy if your clients have been using Accutane that they should be off Accutane for a minimum of 6 months, potentially up to 1 year before receiving microdermabrasion. What changes can we expect to see with microdermabrasion? Clearly, we see an improved texture or softness to the texture of the skin, reduction of the appearance of fine lines and wrinkles. We know that we can diminish the appearance of large pores just by simply cleaning out the filament within the pore itself. It'll create a much softer touch to the skin. It absolutely shows improvement of a non-inflamed acne as it helps to stimulate, detox, and purge out the filament from the pores. It also results in less comedones and milia present in the skin. And overall, due to the massaging techniques that the device offers, we get a lot of stimulation of fibroblast production, which grows collagen for a more toned, tightened appearance. Obviously, the healthier the skin looks, the smoother the skin looks, all those to be expected with the use of microdermabrasion. So when is it appropriate to start with microdermabrasion? I always say that we treat our clients in 3 different categories. Preventive care, which microdermabrasion is excellent for a more younger, youthful skin that is just looking to prevent and care for their skin properly. This keeps the skin well exfoliated, it keeps the filament and debris out of the pores, and allows the skin to function normally, preserving the skin. Corrective care is really for those clients that are coming in with specific unwanted conditions where microdermabrasion can be an excellent modality for. Everything from, again, inflamed and non-inflamed acne, as long as it's not pustular. It can be very proficient on any forms of pigmentation abnormalities. It's very good for laxity and sagging in the skin. It's good for improving texture. All of those unwanted conditions, clients can expect to see very good results within a series of microdermabrasion. It's also ideal to maintain the goals once we acquire those goals with our client's skin. So maintenance then becomes more of an add-on or an upgrade to their monthly facial. As a preventative care, it's ideal as an upgrade. For a corrective care, where we need to progressively treat the skin for these unwanted conditions, I do recommend a series back-to-back with a minimum of 5 or 6 as frequently as every 2 weeks. And then with maintenance care, it's good to maintain them again as an upgrade to a facial. Remember that microdermabrasion can be and is ideal for all categories of clients, regardless if they're preventative, corrective, or maintenance care. So let's talk about the treatment course. Microdermabrasion, as of most modalities that we use, have a cumulative result. Although they will see and feel a difference in the skin with just one service, the real results come from multiple sessions at bi-monthly or monthly intervals. If you're working on a skin type that needs a more progressive therapy, again, and to get the results or meet the goals of the client, it can be done as frequently as once every 2 weeks, as long as their skin can handle it, making sure the skin is barred of any unnecessary redness and inflammation, and that the clients are not using any form of acid or low pH ingredients within the first 3 to 5 days before or 3 to 5 days following this procedure. Clients may or may not experience redness, dryness, and some moderate flaking of the skin for up to 3 to 5 days following this process. It's also recommended that sunblock is mandatory to protect the skin from any post-inflammatory pigmentation or any damage from UVA and UVB. Keep in mind that the treatment course really is up to you as their expert. You are the ones that will know what's best for their particular skin type. Remember that microdermabrasion can also be safely used not just on the face and neck, but the chest and the hands, the back, the arms. And you can see by these before and after pictures that we can expect great results with just microdermabrasion as a standalone service. These before and afters that I'm going to show you is just within a series of 6 standalone microdermabrasions with the appropriate home care regimen. You can see on this first before and after, we've got a lot of post-inflammatory pigmentation lesions, as well as texture difficulties here. So on the after picture, much smoother texture, very lightened pigmentation abnormalities, and an overall better, healthier complexion. This next picture shows a lot of UV damage, sun damage, premature aging of the skin, And with a series of microdermabrasion, this particular client had a series of 12 back-to-back every 2 weeks, along with the appropriate home care system, and in this case was the Power Brightening Kit. We saw a lot of lifting of pigmentary abnormalities as well as improved texture. This shows a little bit more of what we can expect to see as far as telangiectasia, some vascular damage in the skin here caused probably from sun exposure, possibly improper usage of products at home, all sorts of things, but the improved sheen and healthy appearance to the skin is evident here. And then most importantly, it can diminish the appearance of fine lines and wrinkles as indicated on this slide here. The slide to the right is immediately post 6 treatments. You can see there's a little erythema and redness as a result, but lots of pushing out and plumping of the tissue, resulting in a much smoother appearance. Again, some great before and afters on pigmentary damage here, as well as some unnecessary redness and inflammation with some acne breakout here. Big improvement. This client also received 10 consecutive every 2-week microdermabrasion as a standalone. This shows a little melasma from a pregnancy mask that a client has. You can see some dramatic improvement here. This client had 6 services every 2 weeks with the appropriate home care, and in this case, again, the Power Brightening Kit. So these are just to show you some examples of what we can expect to see when clients commit to a series of microdermabrasion as a standalone. Now, if we add it to a facial, we're going to see even more enhanced results because of the exfoliation techniques, the extractions, and masking and other goodies that take place throughout the full protocol. The treatment protocol is very simple. Before the treatment begins, make sure that the client's skin is completely cleansed and dried. We want to make sure that there is no moisture on the skin at all. I'm using long, gentle strokes without applying a lot of pressure. Remember that we don't have to apply pressure with that handpiece. The handpiece does the job on its own. The vacuum holds the skin very tight, so the exfoliating tip is to ensure even exfoliation. Hold the skin very taut to prevent dragging of the skin throughout the process. If more or less vacuum pressure is needed, simply adjust the vacuum dial. Be sure to occlude the handpiece with your fingertip to read the vacuum pressure before getting started, and to always make sure that you ask the client if they feel comfortable. You can follow the technique or pattern as seen in Lesson 2, our hands-on video, if that can help you. Technique is probably less important. It's important that your client feels the confidence in your hands, however, so get your own technique down and then proceed with most cases 2 entire times around the face. Not using any towels or scratchy sponges, 4x4s are only approved in this protocol, and then following up with on-the-mend post-procedure gel and calming the morning day cream, and then followed up again by the Skin Defense SPF. These protocols are made available as well on the hands-on video, as well in the training manual, should you need that. Thanks so much for joining us. If you have any additional questions regarding our microdermabrasion training or the use and cleaning of the NP1 device, please reach out to us either email at education@clarityclinicalskincare.com or simply call us and we can be of assistance. Thanks so much. Have a great afternoon. Bye-bye.